So we stopped off on page 99. We were right kind of at number 4 there, after we talked about the trigone of the bladder. And the superior, middle, and inferior rectal arteries. Of course, we talked about how that's going to be anastomosis and going to be where hemorrhoids are going to occur. So the superior is going to be from the inferior mesenteric artery, the middle from the internal iliac, and the inferior rectal is going to be a branch from the internal pudendal. Cool. Prostatic venous plexus. We talked about how the prostatic venous plexus drains the deep dorsal vein of the penis and drains into the venous plexus of the spine, so metastasis can occur through there. Right afterwards, it mentions, the lab manual is mentioning and pointing out, so it's important to note, the relationship between the ureter and the uterine artery in the female and the course of the ureter and the ductus deferens in the male. So ductus deferens is analogous to the uterine artery in its course above the ureter. Cool? Let's keep moving right along. Sacral splanchnic nerves. Oh, the sympathetic chain in the pelvis and the perineum combines, so it comes down really parallel, and then it combines together to form that ganglion impar right there in the pelvis and the perineum. It's just the last one. So turning the page to page 100, let's go with some important things. So ductus deferens, or the vas deferens, that's what you do to render, like you cut that to render a male sterile. So a vasectomy, vas deferens, we know ectomy is taking out. So vasectomy, vas deferens, cutting, renders a male sterile. The body of the uterus is where implantation is going to occur. The cervix, of course, is where we're going to do pap smears for HPV. The uterine tube, the ampulla is going to be where fertilization occurs. You should have learned that in embryo. The fimbriae, they kind of squiggle. Let me get my hands in. They squiggle right around the ovary. So when an egg is being released, you're going to have a possibility of that egg being released into the abdominal cavity or the pelvic cavity, and that's where we're going to have ectopic pregnancies. That's why we get ectopic pregnancies, is because those fimbriae don't always swipe the egg into the fallopian tubes. Cool. So again, we said the run ligament of the uterus was the remnant of the gubernaculum, and it goes through the inguinal canal. Ovarian ligament is the inferior pole of the ovary, and it courses in margin of the mesovarium, and it continues as the round ligament of the uterus. We said that was a remnant of the gubernaculum. We talked extensively about those arteries. So again, the umbilical artery degenerates after birth and becomes the medial umbilical. Medial umbilical ligament, I'm sorry. Median umbilical ligament. We talked about the uterine artery again, and it anastomoses with the ovarian arteries and the vaginal artery. So if you have a blockage, if it gets cut, you have that ovarian arteries and the vaginal artery to kind of make up for it. Again, the anastomosis of the middle rectal, the inferior rectal, and the superior rectal site of hemorrhage. Talked about that. Aberrant obturator artery, and what is that called if it's nicked? Corona mortis. Syndrome called corona mortis, torrential bleeding. Usually it's nicked in a hernia repair. And if the surgeon isn't smart and doesn't know his anatomy and doesn't know the possibility of this variance, he could be in a lot of trouble, and a normal hernia repair could turn into death, obviously. Nerves, we talked about those nerves as well. So we can just keep moving on. Pelvic muscles. The puborectalis, again, is what maintains the perennial flexure. And it pulls the anorectal junction forward. The levator ani are innervated by the anterior rami of S4. We had mentioned that in the pudendal S2 through S4. Detrusor muscle, I'm pretty sure this is where we kind of got confused in the book because the detrusor muscle was never really mentioned that well in the book, but essentially that's just the muscle of the bladder. The entire bladder wall is a muscle, the detrusor muscle, and it's made up of this rugae, which can contract, and they squeeze out the urine. And yes. Transverse folds, the purpose of them of the rectum is to slow down the movement of the feces, and the ampulla is the lower part of the rectum. You'll notice also that the ampulla was towards the end of the fallopian tubes too, so you can remember that. The pectinate line is going to be important because above it is going to be visceral innervation, and below it is going to be somatic innervation. So below, we had talked about the external sphincter and how that's innervated by a somatic muscle, and therefore it causes pain. Okay, so it's a transition between the ectoderm and the endoderm, outside and inside. Cool. Lymph nodes, something to note. Deep structures of the perineum, they drain into the deep inguinal and external iliac nodes, kind of makes sense. But the testes and the ovaries drain into the lumbar lymph nodes. Lumbar lymph nodes. And moving right along. I think this is the last section of the pelvis and the perineum. Yep. And it has a lot in it, actually. Sucks for the person who is giving this presentation. Hopefully it's not one of you. Gluteus max, posterior femoral cutaneous. So a lot of that first page is going to be the muscles that we remember and know from the lower limb. Correct? Yes, Sam, that is correct. Pudendal nerve, talked about it, innervates what? The external urethral and anal sphincters. So somatic innervation, this is what gives us the ability to choose when we go to the bathroom. It also innervates the levator ani and most of the skin of the perineum, the penis and the clitoris. You have the internal pudendal vessels, so they're branched from the internal iliac, and they go in the pudendal canal. And what branch is given off in the pudendal canal? Go back and figure it out. All right. Lesser sciatic foramen to the pudendal canal again. Follow the pudendal nerve and the internal pudendal artery. Remember, we said it goes out the greater sciatic foramen, comes in through the lesser sciatic foramen to the pudendal canal. The pudendal canal is formed by the splitting of the fascia overlying the obturator internus. Okay. Inferior rectal nerve is from the pudendal. It innervates the external anal sphincter and the levator ani. So we said the pudendal nerve does that, but this is the branch. And then inferior rectal vessels, those anastomoses again. These structures are usually surrounded by the fat of the ischioanal fossa. So that ischioanal fossa is going to be kind of like a gutter between the levator ani and the pelvic walls. And its purpose is to allow the movement of the diaphragm and the expansion of the anal canal. So to push, right? It gives you like a little leeway. And it attaches where the levator ani converges with the obturator internus. So this ischioanal fossa is formed. Here's the obturator internus coming in, and the levator ani, and that junction of them right below, where it's kind of like triangular, is going to be the ischioanal fossa. And they course towards the external anal sphincter, right? Which is innervated by inferior rectal nerve of the pudendal, so S4. Anterior ramus of S4. Dermatome, usually they say it's S5. S5 dermatome. External anal wink reflex is when you touch it and it kind of contracts, all right? So, like winks at you. I know that's really awkward. Sorry. Moving on. The boundaries of the ischioanal fossa. Write this down. Going to be the ischium, the obturator internus, sacrotuberous ligament, the levator ani, and the perineal membrane. Perennial membrane. Perineal, perennial, whatever. Perineal membrane. Please, please, write it down and visualize it. Obturator internus connects with the levator ani. Below it is the perineal membrane. The ischium and the sacrotuberous ligament are around it too. All right. Visualize it so it's more of logic than it is memorization. Okay. Identify the urogenital diaphragm and the perineal body. And the perineal body is where it attaches the membrane to the external anal sphincter, right? Moving on. We talked about all those arteries and the nerves. Go back and remember them. Write down what's important about them, where they come from, what they innervate. We have the external pudendal vein and what drains into the external pudendal vein. The superficial dorsal vein of the penis. And it goes to the greater saphenous vein. Identify the branches. I mentioned that. Going on to the male. By the way, our time has elapsed. Didn't realize, so I'm going to stop here before we move on to the male. Hopefully I can upload this.